Hey, it's Sparky Pfeiffer, 1250 AM The Fan, of course, here in Milwaukee. Also, you can listen to us right now on KISS FM, 99.1 WMYX, or Hot 105.7. Thanks for tuning in to our Public Service Affairs programming here on a Sunday morning. Being joined now by Kristin Waite-Labott, who is the founder and president of WisPAN. Kristin, thanks so much for joining us. For people that don't know what this is all about, tell us why you decided to start WisPAN.
Yeah, thank you. Thank you for having me here today. WisPAN stands for Wisconsin Peer Alliance for Nurses. We are a peer support organization for nurses with substance use disorders. Back in 2005, I lost pretty much everything when I was caught diverting drugs from the hospital I was working for.
That's not good.
No, it was not good. I have an alcohol and an opioid use disorder, and I was a mess. I ended up losing pretty much everything and spent 4 months at the House of Correction in Franklin. That jail stay was my bottom. I never wanted to go back there. I decided right then and there I was going to do whatever I needed to do to stay sober and clean, and thankfully have since January 17th, 2005.
Congratulations. That's great.
Thank you. It's been a long journey to back to nursing practice, and it was difficult. In 2007, first of all, I really thought my nursing career was over, understandably, as I thought it probably should be. I was in a lot of therapy, and my counselor in 2007 asked me what I thought about trying to get my nursing license back. And I just kind of laughed at her, and I thought, they're not going to give me my license back. Why would I even put myself through that? And she said, do you know that they wouldn't? And I said, well, I've not ever talked to them, so I guess not. And she really encouraged me to call. I had decided at that point in my life that I was going to listen to other people and those that I trusted, because when I listened to myself, I just got myself in trouble.
Sure. Yeah.
So I decided to try it. So in February of 2007, I called the nursing board here in Wisconsin and explained my situation. And the woman on the phone, I don't remember her name now, but she was so kind. And really what she said was, we don't want to keep nurses from practicing. We just want to ensure that the nurses who are practicing are safe to do so. Right. So the Board of Nursing in Wisconsin has a monitoring program. So nurses in situations like mine can join this 5-year, it's a long program, but can join this monitoring program, return to nursing practice, while proving, that we're doing what we need to do to be safe.
Sober.
That
Right.
we're sober. So weekly random urine drug screens for the whole 5 years, making sure that we're doing our therapy sessions, that we're going to 12-step meetings. There's lots of requirements of the program, but I joined that program in 2007 and graduated, if you will, 5 years later. And so I have my full licensure back now. The program was difficult. It was so let me just say this. There are about 100,000 nurses in Wisconsin. About 300 of them are in a monitoring program like the one I just described. I thought I was the only one when I was going through it. I had no idea that there were 300
People
other.
are willingly talking to you about this, I'm sure.
Right. So I felt very alone and very overwhelmed. Like I said, I got through the program, but it was difficult. Fast forward to present day, a couple of years ago, I work for a virtual treatment program remotely. Okay. So we work with nurses from all over the country. I talked to nurses and found out that other states have really amazing peer support programs for nurses that are going through the monitoring programs. And I thought, we need one of those in Wisconsin. So I started one, the Wisconsin Peer Alliance for Nurses.
And that's awesome. And again, talking with Kristin Waite-Labott, founder and president of WisPAN. I want to rewind to the beginning, if I can, if you're all right with that.
Of course.
Because I was talking to somebody here in our building that you were coming in and we were having a conversation. And he said, oh, my oldest is a nurse. And then he told me where and so forth. And he said, I wonder if they have issues of nurses or whatever else that they aren't aware of, or whatever the case may be. And he was saying that a lot of them like to go out drinking and so forth. So my question, I guess, is talk about the stress levels. Is it the stress levels that kind of lead down this path? Is it a lot of these people may have had issues leading into it, and then the stress level just kind of put it over the top, or combination. What do you think?
That's a great question. I certainly struggled with anxiety and depression most of my adult life.
Sure.
But as you said, nursing is stressful, and there is not a great resource for managing that stress. We pride ourselves on going 12-hour shifts without going to the bathroom or without taking a break to eat something.
It's
crazy. Ridiculous. So those kinds of lifestyles and expectations, on top of nursing just being stressful, we deal with overwhelming situations probably every day that we're at work. Our patients are really sick, their families are struggling, patients die, and we never take time or moments to deal with that. We just move on to the next patient. And then couple that stress with, post-COVID, of course, COVID was extremely stressful on nurses. Couple that, again, with access to really potent addictive medications. And those of us with a propensity, like I said, I had alcohol and anxiety and depression throughout my adult life. I treated often with alcohol. Then I was exposed to opioids after a surgical procedure. And then a couple of years later, I'm like, wow, we have a lot of really good drugs here at the hospital that I'm just throwing in the garbage. And I just kind of started taking them. It wasn't like a conscious decision. It wasn't something I planned or thought about. It was just we have these really amazing drugs, and I just put it in my pocket.
So does the monitoring system have to be different for these hospitals to monitor doctors, nurses, other employees for making sure that they also aren't kind of taking these things? And I don't have an answer of how this works. I'm not familiar with how the industry works itself, so that's why I'm asking.
Yeah, so yes, I think it needs to start way before that. I think we need to be taught in school how to take care of ourselves and how to manage stress, the stressors, and make sure we know what those risks are.
Yeah.
Make sure we know that this diversion or those drugs, that is a real, present, and current problem, and that we're at risk for that, so that we know what to look for. But yes, we need to be more cognizant of how we're disposing of those medications. We need to be more aware of what the signs of someone who has a substance use disorder are, so we can see that in our peers. And we need to be very careful in handling of those drugs, because right now it's not as tight of a procedure as it could be.
Yeah, no doubt. In fact, there was just a outbreak in Milwaukee County, wasn't there?
Yeah.
I forgot how many people there were that passed away of opioid overdose, and I think the average age was 50. And I was stunned by that, because I thought I was going to see like teenagers or early 20s, and it was much older folk that, you can argue should know better. But when you're addicted to anything, regardless of the age, it's the same path regardless of how old you are.
That's right. Yeah, I think the number was 17.
Yeah, that's quite a bit.
Yeah.
Okay, so my next question is, if mom is a nurse or dad is a nurse or whatever the case may be, are there warning signs that they can pick up on that maybe you don't know mom or dad have a problem, but this is happening around the house, or you're seeing something and you're like, that might be a warning sign, there might be something going on?
Yeah. So, not just nurses in particular, but anybody.
People in general.
Yeah,
right.
people. So generally it is changes in behavior, and a few changes in behavior. So with opioids, we talk about that opioid nod, where people just can't keep their eyes open and their heads kind of bob. That doesn't mean everyone who falls asleep is a drug addict, during the day. There are plenty of reasons why someone would be tired and fall asleep. But maybe in addition to that, you realize, they just had surgery a couple of months ago and have been taking prescription pain medications. And, they're really their personality is starting to change. They're starting to be irritable, and they're starting to kind of bite my head off when that wasn't something they used to do.
Sure.
Maybe they're not taking care of themselves. So they're staying in their pajamas all day. They're not taking showers. They're not taking care of themselves like they would before. Maybe they're calling in sick a lot to work. If it's a healthcare professional, maybe they're working a lot of overtime so that they have access to those drugs that they've come to
I would never
need.
have thought of that option.
Yeah.
Yeah.
So lots of those kinds of signs.
Yeah, that's some pretty crazy stuff. Talking with Kristin Waite-Labott, again, founder and president of WisPAN. I think something else we should talk about is a book that you published that people can get their hands on as well.
Yeah, in 2015, again, at the encouragement of my same therapist,
Yep.
she had a few years earlier encouraged me to write down my story. I was having a lot of anxiety just trying to process everything I'd gone through. So she suggested I just write it down. Once I was finished with it, she encouraged me to publish it. So it's really just my story. It's called An Unlikely Addict, and you can get it on Amazon. And it's, like I said, just my story of how things happened and, how I recovered and how I stay there.
That's wild. Does it publicized throughout the medical community in Wisconsin about this book, if people haven't or no? Because again, I'm not in the industry. I don't want nobody yelling and screaming, Sparky, you don't know what you're talking about. Okay, maybe I don't. But what I am saying is this. If I'm leading a hospital or whatever the case may be, I'm probably reaching out and being, guys, like, hey, look, we bought, I don't know, however many copies of this book. They're there if you want to read them and check them out, almost like a library, I guess, to a certain degree. No harm, no foul, no judgments made. But if you're interested in reading this book about somebody within our industry right here in Wisconsin, it's not somebody from California or Florida, but something that's just like you going through this day to day in the state. I mean, I think it's a great educational tool and a learning tool for somebody that might be struggling with this that could help them pull them out of it.
Absolutely. Part of the problem is that leadership in the healthcare world doesn't necessarily want to think that this problem happens in their hospital.
Of course.
I guarantee you it does. In fact, the American Nurses Association says 10 to 15% of healthcare professionals are struggling with some form of substance use disorder.
And if you think about how many people are doing this for a living,
right,
that number is big when you start talking about 10 or 15%.
Yeah. So, like I said earlier, there are about 100,000 nurses in Wisconsin.
Right, but that's just Wisconsin. Yeah.
There's 4 million in the United States.
Ooh-wee.
Yeah. So we're talking in Wisconsin, 10,000. In the United States, 400,000 nurses alone. That doesn't include doctors,
right?
And others. So it's a big problem. They need to address it. Being willing to open their eyes and see that it's an issue isn't going to harm the issue. It's actually going to help it if they can address it. So I think you're right. Having resources like my book, like WisPAN, so that nurses know about it before they get into a problem like I did. Like, my goal is to reach nurses that need us before they become a headline or before they're diverting drugs and getting arrested and having their whole life fall apart. Yeah. If we can get the word out about WisPAN, that we are there to help and support nurses with substance use disorders before they get to the point where they have caused all this devastation or hurt a patient, because we don't go into nursing to hurt patients. We want to take care of patients.
Help.
Yeah, for sure.
No doubt. That's the other thing. So in my notes here, we've got numbers. We start talking about working impaired while you're actually, I don't know, having had a couple of beverages or opioids or drug use or whatever else. That I never thought of. Been to many hospitals, had nurses all the time. Rarely have ever had a bad nurse experience. Never in my mind did I ever think to myself, I wonder if she's sober. Like, it never crossed my mind. But I mean, the notes I have here, 6 to 8% are probably working impaired. That's scary stuff.
Yeah. And I hate to say it, and it's hard to say it out loud, but I was working impaired, and I put my patients at risk. I didn't do that. I didn't think to myself, oh, I'm putting my patients at risk. The drug use was overwhelming, and I couldn't not do it, if that makes sense. And I convinced myself that I was fine. I absolutely believed that I was fine, that there was nothing wrong. I don't think I ever hurt a patient, but truthfully, I don't know, because I was impaired when I was working. And unfortunately, a lot of other nurses are too.
Yeah, that is just crazy stuff. All right, so now I got questions. So it says here that you are a certified addictions registered nurse and a certified professional recovery coach. So please do explain to me what those mean and how you go about getting certified. And how many of those people are there really around here?
That's a great question. Certified Addictions Registered Nurse, or CARN. It's a certification where I just have extra training on all things addiction related, not just for nurses, but all patients.
Okay.
So I hold that certification. And then recovery coach or certified professional recovery coach, I have through the International Association of Professional Recovery Coaches. And again, just extra training on how to coach someone in recovery.
How important, coach, and you're working with these nurses, to making sure that they have a support system outside of you around them?
It is everything. I still go to my 12-step meetings. I still maintain my recovery. I mean, I work at my recovery every day.
Yep.
It's a job for me. It's another piece of it. I have to do that every day. And part of my job as a recovery coach is to make sure that people have the resources that they need, because it's not just one thing. It's like you need to build that recovery community.
Right. You know, that's the thing about this. And the one part of this that I really, really like. I like everything that you're doing. Kristin Waite-Labott, again, a founder and president of WisPAN. The other part of this we haven't talked about, you said the virtual part earlier, that you have these virtual meetings with people. But the key word when I read my notes for this interview was confidential. So that means, if we go by confidential, that means the only people that know about what's happening are the people that are involved. So you're not trying to get anybody fired. You're not trying to do anything and call the cops on anybody, like anything like that. You're just trying to help get them right.
Yeah, that's right. So we have twice weekly meetings, Tuesday and Thursday at 7 p.m. They're held via Zoom. And we have folks log in just using their first name so that they can talk freely. We don't take attendance. We don't share any information anywhere. We offer a code and a meeting topic at the end of the meeting so that they can prove that they were there if they need that for their monitoring program, because we are an approved support meeting for the program requirements. Right. But it's so important to have a space where you can go and just speak freely and openly, and having a whole group of nurses that have been through the very similar circumstance that you are either just going through or maybe went through some time ago and haven't dealt with completely. It's just so meaningful to have that safe space.
And it's much different, I would assume, you being that person versus me being that person that's never been through it, to the people that are on the Zoom meeting.
Yeah. It just makes everyone feel connected and empowered. Like, oh, Chris got through this.
Right.
You know, if she can do it, maybe I can do it too.
If people want to learn more about WisPAN, how would they go about doing it?
So they can call us at 414-376-7002. They can email us at wispan2021@gmail.com, or they can go on our website, wipeeralliance.org.
What was that website again?
wipeeralliance.org.
Oh, Peer Alliance. I thought you said PR Alliance. I'm like, wait a second, I'm confused.
Sorry.
Peer Alliance.
Peer Alliance. I should
getting
enunciate.
Old. My hearing is going. It's okay. Kristin Waite-Labott, thanks so much for joining us here on Sunday morning. Founder and president of WisPAN. And again, thanks so much for coming on. You can also check out her book as well, unlikelyaddict.com. Unlikelyaddict.com. Thanks so much for coming on. Appreciate it.
Thank you very much, Sparky.
You're listening to public service programming on 103.7 KISS FM, 99.1 WMYX, Hot 105.7, and of course, 1250 AM, The Fan.